Hello again, so it's back to mask wearing for patient-facing services. Hospital visitors, coupled with the now familiar advice concerning risk reduction if you are vulnerable in terms of likely to develop more severe disease if you catch COVID. Since the TT fortnight ended, the rates of COVID disease have actually rocketed in all age groups on the island, often with folk developing a flu-like illness, coupled again with, at least initially, many finding their lateral flow tests show negative results. The past have changed, wherein COVID new variants have found humanoids still very susceptible, but many now, of course, have some sort of immunological memories born out of previous COVID infections, as well, of course, the results of the mass vaccination programme. It's still an Omicron variant that's doing the rounds, and the boffins at the UK National Viral Research Centre at Porton Down still tell us that the present set of lateral flow tests should pick up most of these cases, depending, of course, on the viral load, the severity, etc., etc. Don't take this all for granted, though, please. In the unvaccinated and the clinically vulnerable, COVID may still cause severe disease, hence this latest advice. Mask usage, obviously, should lead to some sort of subtle behavioural changes then, that hopefully will mitigate, at the very least slightly, our social awareness and subsequent day-to-day activities that we associate with collecting respiratory viruses, in other words, things that inhabit the nose, throat and lungs. We have had a few hours of summer this week. I think Wednesday afternoon. It's true, though. The surgery suddenly fielding queries about hay fever, skin rashes, sunburn, insect bites and the like. Some medications, of course, are classically associated with skin reactions in conjunction with UV light. Check the labels and the data sheets and please act accordingly, although your pharmacist may well advise you. Hay fever, usually at this time of year, is due to grass pollen. The usual lines of antihistamines that remain able to assist, but please again read the label, don't overdose in all age groups. Sometimes things all change in such medications, even the routine over-the-counter stuff, so just again be careful. Adding in nasal sprays, often mild steroid-containing agents, eye drops of various types, there is literally something for any age group, size or shape. Add in some practical things like rinsing your hair after coming in from a prolonged period outside or in the garden with children. Changing your clothes too can hugely reduce your pollen load you might be carrying in. Closing the windows at home and car, wraparound sunglasses, air conditioning with pollen filters in cars, if available in your vehicle, may all help this process. We still have regular requests for one-off steroid injections that in those in distress find really helpful. They do reduce the hay fever symptoms for several weeks, but they're not for everybody. And they're not really something that we actually do advise or has been advised. They used to be very popular, but they've gradually become less and less popular, mainly because the advice is not to do it. On another front, there is also a lot of D&V about. Diarrhoea and vomiting, lovely. It's viral, of course, it's short-lived and it's short and sweet. And again, it asks us all to remain alert to this disorder. Let's not forget hand-washing. It's simple. It's drilled into our collective memories, but easy to forget or perform badly, and thus leave yourself open to collecting all manner of minuscule bacteria or spores or viruses. Hand to mouth it travels, the rest is well known. Most viral enteritis, a flurry of usual activity up and down, will clear quickly, but beware, you may still be infectious for up to 48 hours after the most severe symptoms have cleared. Then, of course, our old friends horseflies are making an entrance once more, a bit later than usual this year. These little critters are quite large, they're quite slow-moving, and they can land on you without any sensation at all before their little micro-saw beak-like things puncture the skin, seeking blood products, all in a matter of seconds. Although all manner of midges and mosquitoes repellents may work here, it's always better to have some clothing between you and the bugs. Try not to roam around at feeding times, i.e. fields and wherever in the garden, early evening or late afternoon. They love that time. Most horsefly interactions, though, are not infections, but allergic reactions to the blood thinners that these little critters use to access your bodily fluid. Lovely. Given the very short summer, though, so far, well, a few hours this past week, let's look at sun repellents another time, if it ever does happen, and I'm hoping it will. Until next time, cheerio.